Hi, I'm Minari Shah, and I'm the founder and CEO of Siteworthy. We help brands produce video. And today we're going to be interviewing Shivani Mody, who is an ER physician, given what's going on in the world, so we can just get some facts about coronavirus.
Hi, I'm Shivani Mody. I am an emergency medicine doctor working in New York City. Today we want to share some factual information with you all, with everything going around on social media and the news. We just want to provide you with some information that is coming from a credible source.
So do you know how many cases of coronavirus have occurred so far globally?
So as of March 12th, globally there's been 125,000 confirmed cases and 4,600 deaths.
What are some of the things you're seeing in the ER?
On one hand, we're seeing a lot of fear of the unknown because there is a lot of misinformation out there and there's a lot of unknowns about this virus. On the other hand, amongst the staff in the hospital, there's been a lot of teamwork, a lot of camaraderie, strength. People are really coming together to help our community and to help the world, essentially. And so being a part of that is really great to see, and it just kind of restores my faith in humanity a little bit, that at the end of the day we're all in this together and we're all trying to help each other.
What are other basic things we can do to stay safe during this time?
So we keep hearing it time and time again. So wash your hands, whether that's with hand sanitizer that's alcohol-based or washing your hands with soap and water for at least 20 to 30 seconds. That really helps prevent the spread. But then also avoiding touching your face because that's another way to spread this. And a big one is social distancing. So we've been hearing this term kind of time and time again, but it's really there to kind of help prevent the spread of this virus. And so the recommendation is to avoid crowds, but also if you're with other people, to stay at least 6 feet or 2 meters away. And this is to, not sure if you've seen kind of the flatten the curve graphic that's been going around. And so this is the idea that if we help prevent rapid spread, it'll help us better take care of the patients that need our help, because currently our hospitals really function at almost capacity on a daily basis. So if we practice the social distancing, if we help flatten this curve, it'll spread out the patients as they come to the hospital and allow us to better take care of them.
So, okay, what are the symptoms like? So if you're young and you get coronavirus, what is it going to feel like?
Probably like a cold or a milder version of the flu. Fever, chills, dry cough, maybe a sore throat, a headache. Those are the milder symptoms. You may start experiencing some shortness of breath, and in that case, it might be affecting you a little bit more severely. But at this point, a lot of what we're seeing is just mild flu-like symptoms. It doesn't really affect the young and healthy as much as it affects the elderly. If you get it, you may remain healthy, but you're going to become a vector for the virus and pass it on to our more vulnerable populations.
And what does older mean? And what if you're on the older side, or you have some kind of pre-existing condition? What would you recommend then if you start to see symptoms?
Yeah, so the age that the CDC or the WHO is considering at higher risk is greater than 60 years old. And the comorbidities that put you at higher risk are things like diabetes, heart disease, lung disease. And if you are in any of those categories, try and stay home, try and isolate yourself, avoid public spaces, wash your hands a lot, avoid touching your face, prep for being isolated. So make sure you have your medication stocked for at least a month or two. And if you're really concerned, you can call your healthcare professional and kind of come up with a game plan. So if you do have really severe lung disease, it's not a bad thing to discuss. Your doctors also may be very inundated with lots of patients, lots of questions. So give them a break, kind of understand that they're trying to do the best that they can, but having a plan in place. And of course, if at any point you're having trouble breathing, you feel like your symptoms are really severe, you should go to the emergency department.
And so what are some of the theories that people are kind of putting out there about prevention that you want to see debunked?
The biggest one is masks. The scary thing is I work in a hospital and we're running out of masks, right? Like, it's something that people are buying for hundreds of dollars on Amazon, and we can't get it when we really need it in the hospital. But just wearing it all the time, you're going to find yourself touching your face more. If you don't know how to properly put it on or take it off, you actually increase the risk of putting germs on your face. So please avoid wearing masks unless you're sick, unless you're taking care of someone with coronavirus, because you're actually taking it away from healthcare professionals who really, really need it in this time.
I know you don't obviously know this, but like, I'm sure doctors and everybody's thinking about this. Like, how long do you think this is going to last?
Nobody knows, right? Every day things are changing. We get updates from the CDC multiple times a day. There's so much research being done. There's so many, we're in the process of trying to come up with a vaccination. We're trialing medication. We're monitoring people who actually have coronavirus to see how it plays out. And there's just so many unknowns right now. So it's really hard for me to say,
right,
things are going to change or get better. But the one thing that we can do is really try and help prevent the spread.
And then where's the most accurate place to get up-to-date information?
So the CDC and the WHO are probably the two best websites. They have tons of information. They have tons of infographics. They have videos. And those things are the most accurate and up to date. When you do get information, I would really just urge you to either get it from the CDC, the WHO, from your doctor, or make sure that it's literature based. Those are the biggest things that I can recommend.